Hello, my name is Bobby Crumhansel. I'm a physical therapist, and today I'm going to be doing some joint mobilizations on Irena, who's had some limitations with pain and range of motion at her shoulder, elbow, and wrist. So I'm going to start out with some longitudinal cephalad to caudal mobilizations at the glenohumeral joint. I'm going to assess for the range of motion. The limitation here is with stiffness, not pain. So I'm going to do a grade 3 mobilization, a large amplitude into the end range. And I'm going to progress into a grade 4, which is a small amplitude at end range. You doing okay, Irena?
Mm-hmm.
Okay, next I'm going to do a posterior to anterior mobilization at the glenohumeral joint. Again, following the concave convex rule. This will help to further increase range and abduction. So I'm assessing the range. I'm applying a little bit of distraction as I can feel that humeral head on the glenoid fossa. So I'm going to do start with a grade 3 large amplitude into the end range. And transition to grade 4 small amplitude at end range. And again, this is to help facilitate some range of motion with the shoulder motions. Next, I'm going to do a longitudinal cephalad to caudal mobilization at the sternoclavicular joint. And I've got her head in a little bit of some side bending to put those muscles on slack. Again, I'm going to assess the range. Pain is not the limiting factor, it's stiffness, so I'm going into a grade 3 large amplitude into the resistance and transition to a grade 4 small amplitude into the end range. And lastly, for the glenohumeral joint, I'm going to do a upward rotation of the scapula, trying to keep her spine and head and neck in neutral. So I'm assessing the range of motion. I'm going to go into grade 3 upward rotation. And I'm going to transition to grade 4 small amplitude, more at that end range, try to facilitate that humeral elevation. Okay. Irena's got some limitations at her elbow. Pain is the limiting factor. She's got 15 degrees of play around 90 degrees of elbow flexion, so I'm going to do a anterior posterior mobilization on the radial head. Since pain is the limiting factor, I'm just going to do a grade 1, which is just sort of thinking about it. If and when she's able to tolerate, I'm going to go into a grade 2, which is a larger amplitude within the resistance-free range, and I will try to stay within a pain-free range initially. In combination with that, I'm going to do a posterior-anterior mobilization on the radial head. Again, since pain is the limiting factor, I'm going to start with a grade 1, which is just sort of just thinking about it. And I will move into a grade 2 as she's able to tolerate. Again, this is a larger amplitude within the resistance-free range, and again initially I will stay within a pain-free range. Right there on the radial head is where my thumb is. And lastly, I'm going to do a physiologic motion at the elbow joint just to try to help to decrease the pain. Start with the grade 1, just sort of just thinking about it. Try to ease that pain. And we'll move into a grade 2 as she can tolerate. So the grade 2 within the resistance-free range. And again, initially I will try to stay within a pain-free range. Doing okay, Irena? Mm-hmm. So again, just trying to facilitate some of the extension here. Earlier I was trying to facilitate flexion and extension at the radial head, but again initially it's just to help decrease the pain. And then at the wrist, she's got some limitations. She's only got 15 degrees of wrist flexion and extension. Stiffness is a limiting factor, so what I'm going to do is do a anterior posterior mobilization of the carpal at the radiocarpal joint. So my thumbs are on the proximal row of carpals, and what I can do is move that wrist into the inner range as I provide that mobilization. Again, since stiffness is a limiting factor, I'm going into a grade 3. And I'm going to transition into a grade 4, smaller amplitude at inner range. I can also move my thumbs along the proximal row of carpals as I perform this. For time's sake, I'm going to avoid that, but I can move along that proximal row of carpals. So that was to help with some flexion. Now I'm going to provide a posterior-anterior mobilization on the radiocarpal joint. Again, I got my thumb on the proximal row of carpals. Assessing the range of motion, I'm moving that wrist into in-range extension of what she has, and applying a grade 3 mobilization, large amplitude into that resistance. And I'm going to transition into a grade 4, small amplitude into that resistance and in range. And again, I can move my thumbs along that proximal row of carpals as I provide these mobilizations. And lastly, at the radial ulnar joint, I'm going to provide a posterior-anterior glide of the ulna on the radius. I'm going to do a grade 3. Again, this is to help with pronation and supination. Since stiffness is a limiting factor, I'm going to go into grade 3 and then grade 4. Grade 4, smaller amplitude and range. And again, since I cannot do these at the proximal radial ulnar joint because of pain, I can begin by doing some of these at the distal radial ulnar joint. And then I can do a anterior posterior glide at the radial ulnar joint. Again, grade 3, larger amplitude into the resistance. And then grade 4, smaller amplitude at in range. And that is it. Thank you.